Thank you for joining our first webinar for the Statistics and Data Science and Aging Interest Group of 2025. Before we officially kick off our first webinar of the year, I'd first like to thank you for joining us. And we'd also want to acknowledge our sponsors. We'd like to acknowledge first our founding sponsor, which is the University of Maryland Pepper Center and the University of Maryland School of Medicine Center for Research on Aging. We've also been very fortunate to have support from multiple individual sponsors as well. If you want to be one of those and become acknowledged, you're welcome to go to the QR code we have here. As soon as I'm done talking, I will also put a link in the chat. If you manage to find your way to this webinar, but you're not a member of the Statistics and Data Science and Aging Interest Group, I'll also put a link to join here. It's free and it's open to even non-ASA members. So with that, I would like to introduce our speaker today. We have Dr. Rui Gutman, who is a professor in the Department of Biostatistics at Brown University, who will be speaking today about novel Bayesian record linkage methods with application to Medicare beneficiaries. So thank you so much. I'm going to stop sharing and take it over, or hand it over rather, to Rui. Thank you so much, Rui.
Thank you. Just a second. I put the share on, put the stuff on, and I think I see everything. Yep. Okay. Good. Well, thank you first of all for inviting me to that to do the webinar. I'm excited to show you some stuff today. I see a lot of people are interested in it, even though it's after the vacation. I'm certainly haven't come back. I didn't come back yet. Okay. So I put the QR code here. If you want all the slides, they're in here. You can download them. If not, if you can't get it, just send me a note. Send me an email later, and I will send it to you. And okay, so let's start. I have to acknowledge my funders. So you will see here a couple of projects that we're doing. Some of those are PCORI awards, NIH grant, and we recently have an NSF grant to create some software that you could use all those fancy techniques. So that's kind of like our my spiel. Okay, so let's go into it. So what we had is, let me see, why does it not work? Here we go. So what do we want, as researchers in statistics, right? We want this big, huge database that have demographics and healthcare utilization and genetics and lifestyle, so we can follow people. We know, especially in aging, we can follow them for a long period of time, and then we can find how things are. What type of interventions or lifestyles are influencing their health outcomes. So that's kind of where we want to be. The NIH thought the same way. That's why they created something that is called the All of Us, that is trying to collect about 1 million people, and they have all this information on them. There is only one problem. The one problem is that it's all collected by different type of people and organizations. And all those people and organizations have different restrictions on what they can share on the data and things like that. So most of those are restricting. For example, if you are following HIPAA, they restrict the names, they restrict geographic to the geographic subdivision, so they can't give you really zip codes or things like that. Some of them are restricting dates and other things. Certainly, patients don't like to give SSNs, social security numbers, their telephone numbers, things like that are hard to get. But we still want to combine all those things together. So the way that I'm thinking about that is that there are two type of applications that are of interest. So for example, there are applications where we are interested in really identifying the same person across all data sets. I don't know if, for example, you're thinking about if your credit card is being used by the same person. So for fraud detection, we don't want to make any mistake. Credit card companies don't want to make mistakes. They have to like find that they don't want to make too many mistakes of saying that this is not you using it and declining, or that it is you, or that it is you, and then that it is you and you are declining it, or that it's not you and they need to like stop using the credit card. Same thing happened with law enforcement when we are looking for criminals or other things. We are mostly researchers. So what is important for us is not necessarily to get the right people, but to get the right relationship. So as long as the people are relatively the same, then in their characteristics, we don't care that it's actually the exact same person that I got, but that the relationship is the same. And I will try to like stay within that framework and show you why this is it's a slight distinction, but it's actually important, especially when you're discussing those things with IRB and other type of organization. So I'll walk you through like a couple of applications that we had. And the first application that we had, it was about end-of-life medical expenditure. So the researchers came over and told me, we are interested in understanding how much people are being how much people or Medicare is paying for expenditure for health expenditure at the end of people's life, which is the last 6 months of their life. Usually, it's a constant sum of people expenditures over their lifetime. Constant proportion. So, for example, they are like, oh, they could be something that is a cause of death that is relatively expensive, or we can think about a medically inexpensive cause of death, which is something that looks like that. That happens very quickly. No, any accidents happen really quickly, so there is no health expenditures almost. So that's one type of application that we were interested in. The second one was older adults. Older adults are suffering from traumatic brain injury. The surgeons were saying, oh, we work so hard on keeping them alive, making sure that they that they leave the hospital and healthy in some way. The question is, are they returning to the community? That's kind of like the question, because we lose them after they leave the hospital. So those are the two type of applications. I will try to like show you the things around it. So as I showed before, like what we want is like something that looks like that, a data set that looks like that, where we have like, for example, in the first application, the cause of death, and then the expenditures, and we have some demographic characteristics. And then in the second application, we have the traumatic brain injury severity, and then where they release to the community after a certain period, and then demographic characteristics. If I have these data sets, I'm all done. I can go ahead and do all my regular statistical tools, apply all of them, do regressions, do causal questions, or whatever else that we are interested in. The problem is both of those things come up from two different files. One file, which is a very big file, is called it's a CMS file, or what's come from what we call Medicare file, which includes demographic characteristics. It also including expenditures of how much people pay, how much Medicare paid for certain things. It also includes where the person was he in the community, or in a nursing home, or somewhere else. And the other files is different. So like for cause of death, for example, we're talking about the vital statistic file that come from the CDC. For injury severity, we are taking a registry, which is called the National Trauma Data Bank, that includes anyone that goes into a level 1 trauma center, what their injury severity is, and some demographic characteristics. So that's all good if I still had that ID, right? Because if I had someone's social security, then I match the social security relatively easily. We have a SAS data SQL command, and we can link those two people together, and we get the same big data set that I had before. The problem is that I don't have those IDs. So that's kind of like the whole point. The only thing that I have is something that we call is semi-identifying information, which is their demographic characteristics. So you can see it's red in both of them. That's kind of like my attempt of like saying we have some information that is similar. The goal is, so now I don't know which person is where is whom. So if you don't take a lot from this presentation, I would say this is one of the important points that I'm going to get to is that I don't know who that person is. That means that I have some errors in attaching a person in the first file. Whoops, sorry, you can see it. A person in the first file to a person in the second file. So my way to like do that is actually not say that I have one file like that, one link. I'm going to have a bunch of those type of links. And in each one of them, the people are going to be slightly ordered differently. That this way it's attempting to propagate my error. How am I going to propagate the fact that I am not exactly sure that this is the exact same person? Sometimes I am, so some people will be. So some people in this file in here, the first person, for example, will be the first person in all the files, but some people in here in the middle might like change over time, over the data set. So that's one way to like propagate my uncertainty in that. Okay, so I will give you the brief the brief overview of what has happened in the probabilistic linkage model. You can see the first paper was in 1969. I've been in a conference in September. Not a lot has changed from that, or many people are still talking about that 1969 paper. It's very seminal paper by Feligi and Santer. And what they are saying is, I have two files. I have two people in them. I have all possible records in them, and I'm going to try to like create a big matrix that says a person in file A and a record in file B, are they representing the same person? I'm going to do it by creating some sort of like a distance between those two. That distance is based on Z. Z is the characteristic, the demographic characteristic. For example, do I see that in file A it's a male, and in file B, whoops, so here we go again. In file A it's a male, and in file B it's a male. And the same thing, so I will give it a 1 if they're both males. If one is a male and one is a female, I will give it a 0. I can do it for anything. I can look at age, I can look at zip codes, or I can look at whatever else that I have in there. Now, what they said is that there are two groups, and the two groups are M are the true links. So for one record in file A and one record in file B, that they are true links. They belong to a group of the true links, and then one record in file A and one record in file B are non-links. So most of the groups are non-links, and most of the pairs are non-links, and some of the pairs are true links. And I have a distribution, so that what it creates, if I look at all possible pairs, I get a mixture model. A mixture model that looks like this, that have a large one for the known matches. Those are all the people who are non-matches, and then I have one that is all the matches, which are over here. Okay, so what we are trying to do is find those that are the matches. What you can see here, the old style is create that cutoff that says everything above that cutoff are matches, everything between those two cutoff are going for clerical review, and everything below that are non-matches. What happened is obviously is that we're going to miss some people who in the non-matches that we cut off. So that adds us errors, or we are going to declare some non-matches that are true matches. That's kind of like how those things work. The way that it works, again, there is that, and I'm not going to get into it. It's a mixture model. So like we can write it as this mixture model. You can look at the slide, you can look at the paper. It's not as critical. I will say that if you're looking at from a Bayesian perspective, then what you have is you treat the unknown link between two variables, if it's a true link or a false link, as an unknown variable and a latent variable if you want, and we're going to sample that because that's going to tell us what is true links and what is false links, and the rest of it are just the parameters of the model. Okay. Now, if I look at like one big file, so Medicare file is really big, if you all know. Even if I take it in any specific year, it's like huge. If I take that and I take another data set that is really big, so if I take some million and I take another file that is another million, then now I'm going to have all possible pairs is million times a million, which is becoming very, very big file. So what we're trying to do, comparing all of them, that's going to be hard. So what people have come up with is something called blocking. And what blocking does, it says, okay, I'm only going to look at possible pairs if they're both males. If there is a male and a female, I'm not going to look at that. If it, for example, I'll only look at people within certain ages. So with age bracket, so I'm only going to look at people that are falling within, if their age matches. If their age does not match, then I'm going to throw it away. Or within plus minus a year, something of that sort. So that's what blocking does. And what it does, it's only done to reduce computation. There isn't really a good statistical reason to do that. Sometimes there is, but generally it's done for reducing computation. Okay. So you see that blocking is kind of like an easy thing to do. And that's kind of like how I started getting into the first question of like comparing causes of death and expenditures. We do that and we just do the blocks and I will show you a second. So let's just see what it is. So those are the blocks. So we take the month, day, county of death. So the month, day, and county of death, as well as other demographics like age, sex, and race. And I'm going to create blocks with the hope that like that will give me exactly the same person in each one. So I match on the same month, the exact same day, the same county that the person died in both files, and their age, sex, and race. We think that it's all good, that's like really, really good for us. This is what we get. So file A is the Medicare file, and file B, so file X is the Medicare file, file Y is the vital statistic file. And you could see that I have, just using those characteristics, I'm finding about 47.4 people exactly. So they're one-to-one match. Okay, the rest of them falls into cells where I have 0% in, for example, in the vital statistic file, and then 1% in the Medicare, and 11% and 1% in the Medicare file. That's about 11%. 2 to 2, for example, happens when there are 2 people in the vital statistic file that match to 2 people in the Medicare file. That's at 10.3. And you can see it all around it. So we think, okay, that's actually pretty good. We've matched about 50% of the population, but that's not exactly right because the cells here are bigger. So what that tells us that exactly I have 47% of the cell match, but only about 33% of the population. So only a third of the population is matched exactly in both those 2 files. And in exact file, I have about another inexactly file, but I have exactly the same number of people in each, 2 to 2, 3 to 3, and so on. It's another third. And then the last one is about another third of those that are matched in sizes, 2 sizes that are different. Okay, so now the question is what to do. What happened is that the people that I talked to were like, okay, well, within cells that we don't know exactly, we're just going to randomly select a person and we plug them in. That's kind of like what they putting in. The problem with that is that what happened when you randomly select a person, you are biasing your associations towards the null, towards 0. And we will see that in a small simulation that I've done. Okay, so that's kind of like the first that they've done. What we propose is saying, well, we can do slightly better than that. What can we do? We're going to look at the relationship between variables in 2 different files. In this case, what we were interested in is cause of death and expenditure. And what you can think about that would happen is that people who have higher expenditure have more probability of having a certain disease. For example, cancers are probably correlated with higher expenditures towards the end of life, while diabetes, for example, is less correlated. That's kind of like the notion. Okay, So let's look at what we had. So we had, I will call it YA, the variables that are appearing in file A, YB, the variables that are appearing in file B. So you can think of YA, for example, as the Medicare expenditure. YB could be, for example, cause of death. And then I have the blocking variables, is all those demographic that I showed you, that's the Z. And I have here, what I don't know is how to match people from the Medicare file to people from the vital statistic file. That's kind of like the permutation. So you can think that I can hold the Medicare file straight, and then I just have to like permute the vital statistic file so they will match exactly. And then what the last thing is like the observation, the number of observation in each of those cells that were created by my blocking variables. We can create a likelihood from it that has a couple of things that have all the blocking variables, all the observations that only appear in file A, so only appear in the Medicare file, so they never died, for example. Those that died but never appear in the Medicare file, so those are like the two components. And I have all those that appear in both files. So those are like the three components that I have. So that's my full likelihood. Because I don't know the relationship between those, because I don't know who is the right one, then I have to like go over the entire permutation, all possible permutations of those people, and then J is over all possible cells. Okay, so that's kind of like the idea. That's my complete likelihood, if you would like. And then yeah, that's not as important. Those are like kind of like my prior distribution. You can believe me that they are somewhat non-informative in some way. But what it allows me, if I follow a Bayesian missing data approach, is that the permutation, that to say which file, which person linked to which person in the other file, that's my kind of like permutation. That's going to be a missing data, and I'm just going to sample it. As part of my Bayesian procedure. So we can break it into two parts, sample the parameters of the model, and then sample the permutation. Now, in linkage, what we are interested in is mostly that permutation. Because once I know the permutation, or once I have like some distribution on the permutation, I have the links between people. That's kind of like the idea. Now you could say, okay, that's interesting. How do you make it work? So let me show you just a small example. So let's say that we have expenditure in one file, and let's say that we have some other continuous variable in the other file. Let's say, I don't know, person's hospitalization, or for example, something like that I have in the other file. And I would say, what I care about is the correlation between them. Okay. It doesn't matter what their means are, because I can calculate their means marginally, and the mean marginally and the variance marginally. So the only thing that I care about is the correlation. This is the likelihood. This is what it's going to look like. So what do we see? Let's start with a cell of 2 by 2. So I have two people that I don't know who to match to another two people. Now, if they are totally uncorrelated, if the two variables are totally uncorrelated, I cannot gain any information. But if the two variables are exactly correlated, so they have a correlation of 1, I know exactly which person to match to which which record to match to which other record from the other file. Okay, that's kind of like the information that I have. If the correlation is somewhere in the middle, then that's the amount of information that I get. What is that line here? The line here says, what happened if I do a hot tech? If I do a hot tech, that's the amount of information that I have. So that if I randomly choose who is going to match with who. What's the line here? The line here says, I know exactly who is matched with who. Okay. So what it tells us, that's what it's going to be here, is that I could get a relative efficiency of 1. So I can know exactly who that person is if the correlation is exactly 1. So if the correlation is between two variables are perfect, or perfect identification, then I can find the matches exactly. If rho goes to 0, then my relative efficiency goes to 1 over I. I is the size of my cell, because there is no information to tell me who is related to who. just don't know. It doesn't help me. The correlation doesn't help me in any way. And that's also the bias of a hot-tech imputation is that what would happen is that the correlation will tend to rho over I. So what we are taking, if the true correlation is rho, the bias is going to be this. The bias is going to be rho over I. The estimate will be rho over I. I is the size of the cluster, so we are cutting it by 2, by 3, depending on the size of the block. Okay. So that's kind of like the idea of what happens here. I can show you. So in our example, that's what was going on. We had like, those are the predictor variables. So we have like whether the person is a female, whether they are black, whether they're what their age is. You can see those are like available in both files. We knew where they died. They die is in, out, other, or so inpatient, outpatient, other, we don't know, or they are HMOs in one file, and in the other file, in the VSM, it's inpatient, outpatient, other, or we don't know. Their cause of death as recorded by the coroner, and then some age time COD interaction if you want. And then what we have in the Medicare file, which is the last thing here, is Medicare A plus B, and then Medicare A. The Medicare A plus and B is only for 20% of the population. So we have Medicare A for everyone. Medicare A and B is only for 20%. Okay, so a couple of things that you should note is that the place of death, although it looks very similar, it's recorded slightly differently between the two files. And then, as I said, the cost variables is 20%. We only have part B for 20%. Whoops, sorry, went too fast. Okay, a bunch of models. We can model all of those things sequentially. You could, again, see it in my presentations and stuff. So we will do that. Let's see. We have a way to like handle an unbalanced cells, but what I will try to like to show you right now is for balanced cells. The reason, again, it's just too short for me to like show the whole thing, but also everything is in the paper as well. So first of all, the computation that we're talking about here is huge. Okay, like we are talking about a data set that was about 1.5 million by 1.5 million. This is a pretty big data set for a lot of people, maybe not for everyone. We used a bunch of things to like handle that. We changed the sparse matrices algorithm to make it faster. We used some fancy Gibbs sampling and block matrices and things like that to like do things faster. Again, I can talk to all of you afterwards, but let me show you some of the ideas here. So I took those that are matched exactly 1-to-1. So we know that those are the true people. True people. I know exactly the truth on those 555. What I did, I simulated about 202,000 cells. So I broke them into cells. So I don't know what the truth is. And some of the cells are going to be exactly matched. Some of the cells are going to be and what I would compare is what is the estimates when I know the exact matches. What is the estimates when you use our methods, and what is the estimates when you use like a hot tag? So like you just randomly assign people. Okay, obviously everyone always shows you that their stuff works very well. So like, yes, my stuff worked very well. So this is our method. This is the estimates from if I knew the true match, and you can see that they're pretty much on this line. There is some variation here on those low values, and I can explain later how we dealt with that. That's just that's because of the modeling that we have used. While if you do a hot tag, if you randomly put people in, you see what happened. It's the attenuation towards 0. You could see that the line is just breaking towards 0. So both the negative goes close to 0 and the positive goes closer to 0. So that's kind of like just showing you this comparison. The fact that we don't know the truth will increase our precision. So we are going to have larger standard errors, but you can see that they're not like significantly larger. They're not like something that is out of that value, but they are going to be larger. The other thing that I can show you is how those cells are relatively well calibrated. So I can show you that about the true matches, we are finding about overall, we're finding about 70% of the 72% of the true matches, and when we say that we know the true match, it's relatively well calibrated, because when we don't, when the correlations are low, then we are about 50%, and when the correlation are high, we're about 90% or so. Okay. So that shows you again what I did. I took variables that are not the same from the two files, and I used them to inform me who are similar, who are the true matches. That's kind of like the main point in the whole process here. This is something that has not been done in all the Faligi Center and a lot of the currently used algorithm, using variables that are coming from two different files. Okay. So now I can show you the regression coefficients on the full data. So the full data, I don't know only the truth, but I can compare it to only those that were exact match. Now, who are those? Obviously, I will see differences, because those that are exact matches are coming usually from smaller counties where people die in specific days and things like that. So those things I don't expect them to be the same, but as we saw before, there are some of those low ones that are kind of like off the line. And our thoughts, again, it's a modeling issue that comes up from those regression coefficients. So what we actually compared is the marginal means. And what you could see is that we will have some differences that are happening here on the marginal mean. So some of the more expensive deaths are somewhat on the higher hand compared to the exact one, and some on the lower one are kind of like pulled away. Not all of the what you can see here, that the variability is not all above the line as we saw before, and the reason is because we added more people. So it really depends on the variability among the people that were not there to the variability of the people that we have. And if I want to summarize this whole thing, this is what we got in the end. So I could like say, okay, for people who died from car accident, their mean expenditure in the 6 months before they die was about 14,000. If you had Alzheimer's disease, was 15,000. Again, this is the 2013 data, so don't capture what it is now. And then this one is the higher ones were leukemia and non-Hodgkin lymphoma that were about $40,000. $40,000, and you can see here our estimates. Okay, so what can we do with that? We could let's see, we could save money by offering everyone to like start putting apples in our vending machines, or I guess in this world we can have slightly cheaper solution, which is following reducing like the changing the rule of driving. Okay. Now, you could combine what I've shown you. So you could combine. So what I showed you is that like if I use variables that are not the same in both files, I can improve my linkage, and I could still use the same framework that I showed you earlier with the Faligi Center, where you could combine those two things together, and you could get better estimates. And this is, we have shown it both analytically and a proof with the students of my Gary, that the paper is mentioned here, that we could actually get better estimates if we do that. Okay, so this is my first thing to show you. The second one was the NTDB. So the NTDB, after I said that I can do everything, like people come and say, oh yeah, you can link everything. And I like, yes, I can. And they come to the office. We talked about the data. I obviously didn't look at the data, and we thought that we could do it, because I was like, that we already did it a few times, we can do it again. Okay, so what the problem is here? The two data set, the National Trauma Data Bank, works really, really hard, so nobody else will be able to link it to anything else. And how do they work so hard? They don't give you where the hospital or the patient is. They only give you the area of the country. So they divided the country to 4 quadrants, and they tell you which part of the quadrant you are at. They don't tell you the date, the age of the person. They just tell you, they don't tell you the date of birth. They only tell you the age of the person. So they worked really, really hard to remove a lot of information about that person. So this is practically what we had. We had the admission year. We don't even have the date that the admission had occurred. We only have the admission year. We have the age, gender, region, hospital bed size, hospital burn bed. Is the trauma center has a burn bed? Does it have a pediatric bed? Those are pretty much the things that we have. And I was like, sure, no problem. We will find exactly who links where. That's kind of like where we try to like do that. And let's see. I wanted to show, yes. So first of all, I will just show you the admission summary from each file separately. You can see that they're not really the same. They're kind of like different in their population and who comes in. And we tried to do that linkage with those characteristics that I have there. And this is what we got. So a cell that have exact match, we had 15 people. The rest were matched somewhere all the way up here. So you can see that the maximum was one person matched to 103 people in the Medicare file, and 71 NTDB were matched to 348 in the Medicare file. So pretty hard matching linking algorithm. Okay, so we do have another set of information that people have not thought about, or that people don't think that is very important, is that we know which hospital each patient received care in. So we know that the person received care in hospital A. We know that person received, so who are the ones that received care in hospital A? Same thing we know about hospital B, and same thing we know about hospital C and D. So that actually is reducing. That's kind of like the blocking that I said before, but it reduces the amount of things that I have to like link on, and it's easier, make my life somewhat easier. The only problem is that they didn't tell us which hospital is which. They just named them in one file. They say this is ID 1, 2, 3, 4, and in this file that's ID A, B, C, D, and they don't tell us which one is for A and B is for C or any of those. So, okay, so what do we do there? We did something that is two levels. So we link the hospitals, and then within the hospital, we link patients, and we are going back and forth. So you can think that as I link more patients, I am more sure about the hospital that I link. As I link less patients, I'm less sure about the hospital. That's kind of like the idea. So I can show you what that does. So now we have a model that is kind of like extensions that says, first of all, are you in the same hospital? Then I can say if you are a link or non-link. And if you are not in the same hospital, then I know that you are not linked. So that's kind of like the way that we created that. We have a likelihood, we have a prior. I can show you a results that goes from it. Obviously, all the simulation looks great. And we'll try not to take too much time, but like, let me show you what happens. So if I don't do the blocking, so red is kind of like my probability of being a link. And you can see that what happened is that everything is kind of like orange. Everything could be a link to anything else. What I could do, I could say, you know what? I will link the hospital separately, and then I will try to link people within the hospital. What do you get is that like, yeah, now I started to like see things that are not exactly supposed to be links, and I start seeing something here along the line, that's the line that says like how people are linked, but I still get a lot of people that can be linked across those things. If you use our method, you could see that you are going to not only link, but you're going to link very good, like within, like you only link people within the right hospital. So like we really are linking people within the hospital and the hospital themselves. So that's actually very good. And you could see it also here that doing jointly the people and the hospitals at the same time, you can get like great links. And if you don't, then you're kind of like messing those things up. Again, pretty large data sets. Here we had like 20,000 people, 20,000 admissions. Here we had 23,000 admissions, and between those years, it's actually there are more, but we are only looking at hospitals that are burn bed. that's how we started with, because we are pretty sure that our linkage is very good there. So it's only 91 hospital. The actual number is about 300 or so. Okay. These are like our the stuff that we have. These are the blocking variables. These are the record variables. These are the things that we were interested in. We wanted to see if the initial score that you were recorded when you came into the ER was influencing your return to the community after you were released from the hospital. Okay, so what do we have? So if we do no blocking, we are practically linking about 5,000 people, and we are not as sure about that. If we do the conditional, it's about the same. If you do our stuff at the joint, you get about 9,000. You can see that the standard error is relatively big here. The reason is because every time that you flip a hospital, you create larger differences. So we're linking both together. So our standard error is slightly bigger here in the number of blocks. Okay. What did we find? Actually, wasn't very exciting for the doctors. What happened is that we find that both the injury characteristic that happens once you get into the hospital are not correlated by how well you will, what's your probable propensity to be released within 100 days from the hospital. The reason is because once you are released from the hospital, it doesn't matter what you came in with. That's kind of like what happened. They're released from the hospital, they go to the nursing home, and then only the nursing home characteristics are going to influence, or like what it was recorded at the release stage, is going to be influencing what, or is predictive of what your chances of being released from the community, and not so much what your injury characteristics are. So that's kind of like what we found, a null result, but you couldn't do it without doing all the stuff around it. Okay, so I don't have a lot more time. I will try to end. So I will just summarize what I've shown you here. And I know I ran through a lot of stuff and skipped a lot of the technical details, but again, they're in the papers and something like that. Okay, so first of all, the important thing that I wanted to tell you is that if you do Bayesian record linkage, you are going to account for the errors. I know a lot of, and actually it happens a lot. Like if you look at all the linkage data that is out there, or the link data that is out there, most of it does not account for the linkage errors that occurred within it. So, and most people ignore it in their analysis. So that not only affects your point estimate, but it affects your standard error. So like those two things are problematic. So if you care about that, there is a whole paper that I wrote again with Gary that was just published in Statistical Science about procedure to adjust for it. One way to do it is, again, is using those Bayesian record linkage methods, because we can propagate the error relatively easily. And what I do is I run the hardcore algorithm once to create the linkage, and then I create multiple data sets, multiple link data sets, so my investigator can use multiple imputation rules to correlate those to account for to propagate that error. The other thing is, you can improve record linkage by not only including variables that are in that appears in both files. Most algorithms these days are only using variables that exist in both files. They are not using relationship between variables that are exclusive to one of the files. That improves the record linkage. You get better links, and you get less errors. So that's the second point that I was trying to make. The third point is that we could come up with algorithms to find, even if you think that the data set is somewhat anonymized, there are ways to find people that appears in both files. Here, what we use is some sort of idea of natural blocking. So we link them both together. So we can use the linking of the hospitals that were not thought to be as important to help us find the people. So that's improving the linkage again. So those are like the type of things that I think that you want to take from here, that like we can do better methods of linking, and we want to propagate the errors. Two important things. Again, there are like a lot more things to do. So I just need to find more funders. You can see I got 3, but I need to find more funders for the other stuff. So we need faster algorithm because it's much larger, to work with much larger data sets. That we are working on the second part, which is a generic software. So like we did receive some NSF grant to like create some software that we can insert into R, and we are making good progress. So we hope by June that we will have some for some of our algorithms readily available software. It is important to think about the distributions for the covariates that are observed in both files and other things. Like there is, again, currently it's kind of like more looking at how things are similar. Which is fine if you have a binary variable, which is like males and males and females and females, and you want to say like that we only we model it with the Bernoulli, if they're a match or not. But when you have names, there are actually distances there, and people just like discretize them if there are, and we can show that discretizing is not necessarily the best idea. The second thing is, again, a lot of other things that we're doing right now is how to do causal questions with linked data sources. There is a few papers out there, and we are working on some more. And then obviously linking 2 or more files. Okay, so I think yes, I'm about at time. So these are the papers, some of the papers that I mentioned, and I can share more, but I will take any questions that are out there.
Thanks so much, Rui. So just a reminder, if you have a question, please put it in the Q&A. We have a couple questions so far. So earlier, when you talked about the example of wanting to estimate costs at death, Allison Trankoff had a question about what your workflow looks like. In particular, when do you delete the records that did not die? Since your objective here is to find out costs at death. Or do they just sort of, are they treated as dropouts in some way?
Yeah, so okay, that's an excellent question. So the flow is that the Medicare file comes up with anyone who has died. Like, so we know that they have a death in there. At least for that purpose, we had everyone that there was a sign that they died. We know that they died, so that's where we remove them. The vital statistic file, I hope only include dead people. That's kind of like the workflow. So the Medicare file came in after we trimmed people that have the indicator that they died. I know that's not perfect. I know that it's slightly better now because they are actually comparing to the vital statistic file in their back end, but they don't release that to us. At least they don't release the cause of death to us. As far as I remember, linking a person, you could ask to link a person directly through Medicare. I believe it's a 5 cent per person. So now multiply it time your how many people you want. 5 cents become like a large number for a grant. Like time a few millions. That's becoming pretty big. So it depends how you want your data set. It is possible though.
Yes, we could all use more funding. So another question regarding the computational resources is, are there any libraries in Python with these kinds of Bayesian algorithms? And they're saying thank you in advance.
Sure. Excellent question. I will divide it into a few answers. First of all, I thought that Python is so much faster than anything else that we can run. That's not always true. It really depends on how you write the Python code and what exactly you are doing to compare certain things, but Python is not always faster. And you could make things run faster for any specific problem. For my first for the first thing that I showed you, we have a Python code. I tried to submit it multiple times to statistical side I forgot the statistical software, Journal of Statistical Software. Every time it comes back to me because they weren't able to load the packages to get the right Python, because we rely on other type of packages, and they were not like able to like load the other type of packages and all those other things. But the paper is out there. If you want, I can certainly share it with whoever wants. I believe that it's the first author is Edwin Farewell. He was a student of mine. So there aren't a lot of packages to do everything. It really depends on the type of things that you're looking to do. There are more packages that do the Faligi Center stuff, but less packages that do the more advanced stuff. Again, as I said, like we're kind of like starting to work on building algorithms to do that and putting packages out there.
Yeah, that'll be a tremendous resource for the community. So here's a question from Karen Nielsen. She's asking, can you speak about ethical considerations that come up during record linkage? For example, inadvertently identifying specific hospitals and data sets that have been anonymized, and does the Bayesian record linkage approach give rise to any additional or fewer such situations? Any anecdotes from your experience to share?
Yes, I do. I have a lot of anecdotes. I think the main anecdote is when I write my message section to IRB or CMS or anyone else. I think I'm too complex for them to understand, that they're like, okay, you're fine. That's kind of like my promise to them. But yes, we are. You could certainly identify people with those methods. And we promised them, first of all, we do it only for research purposes. So all my stuff that I've done is for research purposes. And we still maintain the same type of restriction on doing that. What's nice about the Bayesian record linkage is that it's not exact. What I mean by that one person is actually matched to if you want to think about it, to multiple people. I'm not saying that this is the exact person, but I'm only giving a probability of the two records being a link. So that's the second component. Yeah, you can think about it many times at night. I wake up and I try to like think about who is going to come after me for the stuff that I've just done, which IRB will come after me, or some other organization. But yeah, we really try to make we don't have we for example not connect those things. I haven't run any of those things on trying to like find that person in Facebook or something like that. We really treat the stuff as we have. I think that the one of the problem is that as you create more of those linked data sets, they can be linked to some other data sets that people do have identification information. So yes, it's like being a record linkage. It's like the decoder for the people who tried to encoder before, right? Like that's kind of like what we're doing here.
All right, Charlie, you have a question.
Well, it's not a question. I was sort of a comment. In addition to being the interest group chair, I'm also the vice chair of my institution's institutional review board, and I've done linkage studies myself. And everything you said, Rory, about this is a big issue. And some of my computer science friends tell me that there is no such thing as de-identified data, and we also have legal restrictions. And this is going to be a challenge for the future. And it might even be worth a future webinar just to deal with the ethical and legal challenges and regulatory challenges of this. But Roy, everything you said is absolutely correct.
I think that even the NTDB, I applaud them. They did a very good they're at the point right now that they don't give me the data. Actually, they don't only me, but they don't give anyone else the data. They say, you have to like promise us that you're not going to try to link it to anything else. Because they worked really hard to like try not to make sure that you can identify. And I will always, you know, like I or others can be smart enough to like find ways to like do that. Like, so they didn't think that the hospital information is useful, but it's very, very useful. So same thing you could say about the same thing arises, for example, for families. You might not think that telling someone like the size of their family or like, you know, certain things about their family, that could actually very much help us, because that's also some sort of organization that we can use to reduce who it is, who those people are. Especially now that I start to know, right? Like, oh, how many people are in that family that are of certain ages? That will help me in like finding out who that family is. So yeah, I totally agree to that.
Yeah, I'm wondering if we're going to get to a point where IRBs just don't approve this kind of work until they can come up with a better way to regulate it. So switching gears from the ethical side to more the procedural side, Junaid Siddiqui has a question about your slide 20, where you specify your likelihood. And his question is, why are there variables that appear in both files but are not treated as blocking variables?
Oh, excellent question. So yes, I will go back to that. That's slide 20. Let me see. Thank you, Junaid, for joining. 20. Those are not the files. Did I miss something? This one probably, right? Like 26. So yes, they are looking like similar. For example, place of death, they are looking somewhat similar, but they're not exactly. What happened is in the Medicare file, they're actually recording if someone is a part of an HMO. Or a Medicare Advantage, if you want to think about it. While in the vital statistic file, they don't tell you if it's an HMO. They just tell you an A, so they could be that they don't know or something else. So those things are not exactly aligned. Actually, if we looked at that, even among the people that we know the truth, they're not exactly aligned. So you could create a function for it, but when they're not, then we are treating them as a predictor. So we are treating them as the relationship between them. Again, this is new stuff that or more novel stuff that we have created, and we see that it works better because it allows us to like model those relationship better than just like assuming that, oh, in has to be equal to in, out has to be equal to out, and others to others. I hope that answers the question. If that's the slide, I hope that I got the right slide. I could go back to this part if you are asking. If the slide 20 says that what happened is that some people are not in either file. It's why people are not in the same, why people that should be in both files are not. That's an excellent question. Because we don't know the underlying truth, but we still see some that we can't trust their linkage in some way.
Got it.
The files also are not the same size exactly. There are some people that could be there.
Okay, thank you. So I am looking at the time. I see that it's 2 o'clock. So we're going to wrap up the Q&A portion. As always, for those of you interested in joining, you're more than welcome to. If you have nominations for a speaker for our webinar series, please reach out to me. And I would like to thank today's speaker, Rui Gutman, for kicking off 2025 in such an excellent way.
Great. Good to see you all.
Good to see you too. Thank you so much, everyone. Have a great rest of your week.
Thank you all for being here.